Okay, we're here to talk about nursing, your course specifically. I'm Bridget Henderson. I introduced myself in the other room. This is Rebecca Rose, and she's part of the placement team, and she'll be talking to you shortly. And then we have Amelia, and we have Luke, and these, without these two people, nothing happens. So these two people are very, very important to you. All right, let's talk about nursing. My favourite topic, and this is the first day of an amazing career. Right? You have so many options. It's not just working in a hospital. This career can take you anywhere. I'm a nurse. Beck's a nurse. We're not sitting in a hospital, right? We went into education. We started off in the hospitals and went into education. You could do something like health informatics. You know, if you like computers, if you like working with numbers, you can improve systems and the way the health service functions by working through data. If you like research, if you want to travel, lots of options to travel. Everyone needs a nurse. Generative AI ain't going to replace us anytime soon. All right? We're needed. So you have lots of options. Have you any thoughts of where you want to be? Anyone any thoughts yet? What do you want to do as a nurse? What did you come up with? Yeah, what did you... I used to be a military nurse for 15 years. Come talk to me later. Yeah. So cool.
I would like to try a travel nurse.
Travel? Excellent. Yes. And is that, would you like to be working through travel agents, sort of making sure that people have the right vaccinations and the right health? Or did you want to work international, global nursing?
First, I just need to,
Yeah, get your qualification. But there is a really cool slot for you if you want it, where you work for a health insurance company who does, you get health insurance when you go over holidays.
Right.
Well, when you have a car crash and you need to be medevaced out of that country you're in, guess who they call? The people who work in that environment are nurses, and they organise the medevac. Even though they're sitting in this country, they're getting someone out of Tibet who fell off the mountain. Yeah? Okay? So that's a cool way to go. Anyone else have any ideas where they want to go with this career? Yeah?
I want to be emergency triage.
Emergency, yes. Well, emergency, you don't just do triage, right? We're both from emergency backgrounds. You do the whole kit and caboodle into resus, all the exciting things. Cool. Anyone else? Or you're just going to get in there and see what you like. Okay, but think big. Nursing's moving more into community, into public health. It's going into very different areas, not just that big hospital. Right? So it's a big career, and you're going to really enjoy finding out where you want to go. Alrighty. So what are you going to learn? So the first year is very much so, this is what you start in this semester, is very much your fundamental skills. So getting a handle on the legal, the ethical, the left and right of what you can and can't do, a bit about basic nursing skill. Because you've got to have your basics, right? Got to have your basics. Then the second year we bring it up a notch, and you start to get some really interesting pathophysiology. You learn anatomy and physiology in your first year. Now you're going to layer on, all right, I understand what the heart should be doing, I understand what the liver should be doing. Now I'm going to work out what happens when it goes wrong and diseases happen. And then what does that mean for that human? Okay. And then a bit more skill development, how to give injections, how to put in catheters. Now you're basically sticking things in people. So you learn all those. And then your third year, we start to get you into that space where you are a critical thinker. Because if you've got a sick person, as the registered nurse, you've got to work out, what am I doing? What assessments do I need to do? What do I think's going wrong? What do I need to enact here? So we need you to put all of those things together to work out, how do I manage this patient? What care do I need to provide? Beautiful. And we learn the role of the RN. Like, what is that job? What does it look like? And then you've got some placements, and they help you sort of get immersed into the nursing profession. And we do some labs here before you go out on placement, so you can practice sticking things in people before you go stick things in people, okay? enrolling in topics and classes. Obviously, you've come in. Has anyone done any of this yet? Yes. Good. So you've worked out the system. At first, it looks a little clunky, doesn't it? But then you get the hang of it. It's pretty easy. You sort of select what your topic is, and you bring it across, and then you click it in, and make sure you're enrolled and agreeing, and then it turns up in your little preview window of when your class actually is. Yeah, you can see this is creative writing course, not at all nursing. So you want that icon. Has anybody not found that on their Okta dashboard? Have you all done that? Perfect. Talking to the converted already. Great. However, don't forget this bit. A lot of students forget to withdraw from the topic. And it's really, really, really important that if you decide at some point, like, oh, I can't do 4 topics, this life is just getting too much, I need to pull out of one of those topics so that I succeed, and I'm going to come back and pick that other topic up later. Do it before census. You heard them talking about that, didn't you? Yeah. Right. If you go past census date, so always be aware of when census is. If you go past census date and you've pulled out but haven't done it properly, you'll get charged for the topic and it will be recorded as a fail. And you only get a couple of goes. How many goes do they get at a topic? Like 2?
You get 2 and then you get put on sort of a study plan.
Yeah.
I'm pretty sure you succeed.
But you don't want to waste a go, and you definitely don't want to waste the money. Who's an international student? Yeah, seriously pricey, right? Yeah?
I was going to ask a question.
Yes.
Are the 4 topics that we're studying now mandatory, or
Yes.
are they just, we can cancel later?
I see what you mean, option topics or whatever. No, you have to, all the topics that are in the course, you have to complete them all, but I'll get Luke to speak to how that timetabling can look, okay? So withdrawing from topics, there is a web page, see that one? So you can go there and it'll give you the instructions. Make sure you go through the instructions to properly withdraw so that it's not recorded and you don't get charged. But if you don't make it by census, they'll charge you again for the topic. And then you can go through a process of asking for a remission of fees, but it's a drama and you won't always get it. Okay, so keep an eye on when census date is for that topic. So I think this is my, you've missed the songs and the dancing. Okay, Luke and Amelia, if you would, I'll just hand this over to you. It's for live streaming, so they can hear.
How's this work?
Yeah, just stick it on and...
Cool. So, hello. As mentioned earlier, I'm Luke, and this is Amelia on my left. We are part of the Student Services team at the College of Health and Enablement. So we understand that administrative processes and the university life in general can be very confusing at times. So our role is to assist and support you throughout your course and to help with any inquiries you may have. So that might be things like helping with your topic enrolment, assisting you with your class registration and organising your timetable, any course progression issues you might have, or inquiries as well. Understanding a study plan and helping navigate the student systems, or even something simple just like helping you find where your class is as well. So we are also a really great bridge to other useful services throughout the university. So for example, if you are struggling a little bit academically, we can definitely help you get in contact with your topic coordinators and tutors, and also guide you to our student learning support services where you can get help from tutors with understanding the content and help with assessments and things like that as well.
Thank you, Luke. Okay, so on Monday we sent you all a welcome email with some information. When you get the opportunity, we recommend having a read through as it includes a study plan for enrolment guidance. So that'll let you know what you need to enrol in for your first semester. Written and video guides of the entire enrolment process, and then helpful information to begin your course smoothly. If you would like to reach out to our team, we would recommend that you contact us by phone, email, ask Flinders, or you can come and see us in person downstairs. We've included these avenues in this slide for you. From me and the Student Services team, we hope you enjoy your studies and we wish you the best of luck. I'll get you back to Bridget. Oh, wait. Oh, yeah, bundles. There you go.
So we can have a quick look at your bundle for your first semester. So I imagine quite a few of you have already enrolled already. If you haven't enrolled yet, as mentioned, we have sent an email with some instructions on how to and which topics to enroll into as well. So it does look a little bit funny and it's a little bit stretched out, but it essentially shows you the 4 topics you can undertake this semester, along with the dates that they are held over as well. So you can see your dates up the top and then your topics along here. So as you can see, there is A represented on that. That essentially just means it's an in-person topic. So when you go through your next years of university, you might see there's an A/O, and there'll be a little legend that explains it a bit more detailed. But if it's O, it means it's an online topic. If it's A, it means it's only in person. Does anyone have any questions around the enrolment process or timetabling or anything like that?
Do you think it should be online and in person, or are they already picked up for you? So
Yeah, great question. So the question was, can you pick to go in person or online? It depends on the topic. So some topics are only offered in person, some topics are only offered online, and some topics offer both, and you will get the opportunity to pick either or. And you can sort of switch as well. So if you pick in person and then realise, this isn't quite working, we can sort of organise moving to the online version or vice versa and things like that. Did anyone else have any questions? No. I'll hand back to Bridget. Thank you.
There's another couple of people who just came in, and I'm sorry, but I danced really good and I sang a good song and you missed it. Okay, communication. When you get into your class, the person you're going to communicate with is the tutor. So you'll have a tutor who's standing in front of you in the face-to-face classes or is meeting you online. So any questions you have about your course, the topic itself, the assessments and what's required, tutor first. If you can't get what you need from the tutor or the tutor can't help, you go to the topic coordinator. Each topic has a topic coordinator, and that should be mentioned right up on the welcome page, who the topic coordinator is. And most often, the way you communicate with the topic coordinator is you use the generic code for the topic, NURS 1025 at Flinders, and that'll get to the topic coordinator email Dropbox. So use your code of the topic that you're in to communicate with your topic coordinator via email is the best way to go, and they usually pick that up. If you can't get any joy from your topic coordinator and you're not getting what you need, then it's me, course coordinator. And my email address would be bncoursecoordinator@flinders.edu.au. Okay? Or you can use my personal email, but I prefer it if you send into the BN Dropbox, only because I can capture it all in one spot. Sometimes I might miss it if it's in my personal email. Another way we communicate is, so that's the way you can communicate with us and we can communicate with you. Always use your Flinders email address. Don't use your Gmails and all the other Fandango ones, because we won't communicate with you via those. We use the Flinders email always. So you can link it up in the background to your personal email, so it'll ping through, but make sure you use that to communicate with us. But we'll also send out announcements on this BN course information, so you should have that on your dashboard, and information will go there, including this PowerPoints and this webinar that we're doing today. It'll be live streamed and put up on there. And if there's a big course announcement, I'll put it there. Also, your little topic tile, in there, your your topic coordinator for the topic will send you announcements through that system. So there's lots of ways to communicate. So just let us know if you haven't got access to that particular tile on your dashboard. So we did some, I'm going to just quickly skip through these. So you do have a lot of supports, and they gave all of that to you in the previous session. And the other thing that you might be interested in is the student learning support services. So if you're struggling academically, so they showed you a lot of health and well-being supports, but we also have study support. And you can access this via that email. Okay, so you put in student support services, Flinders in Google, and it will come up. You get study buddies, you get feedback buddies, and this is all through the library. And there's a wealth of information within that. So when you've got 5 minutes, just search through it and see what your study buddy is. And I'm just going to quickly remind you that there is a health and counselling again. They did talk about it, but it can get a bit stressful trying to juggle studying and nursing. Because we've got a program that spreads out, it's not specific semesters, you're constantly at university. You're either at university studying or you're out on placement, and it goes all year long. The other students get a bit lucky, don't they? They get a nice big break. They have semester, and then they have breaks. No, we're hardcore. We're going to go down fighting, and we're going to keep going all year. And you get some breaks between topics, but your timetable for this semester only is a semester one. After that, it gets very spread out because of placements. So you may need to talk to someone at some point. Now, don't go melting in corners or by your little self. Please come and see us. Please reach out. There's lots of people out there wanting to make you succeed. We want you to do well. So don't just disengage. The more, like Seb said, the more you come to us, the more we can help. And then there's ISS for international students. So I'm sure the international students, have you all linked up with the ISS group? Have you been up that way? Yep. If not, make sure you Google them up on the Flow site and go meet greet. And any Aboriginal and Torres Strait Islander people in the room? We'll skip past that one then. But there's Ugarinthi for anyone online who's Aboriginal and Torres Strait Islander background. And as we saw in that other meeting room, that they have lots of support for our Aboriginal and Torres Strait Islander community. So placements, let's talk about placements. This is an important piece.
Okay, so for those that have just joined us, my name is Beck Rose and I'm one of the placement education coordinators here at Flinders for nursing. There's two of us in this role, so you might come across myself or Jodie Price, who'll be returning next week. So I'm going to spend a couple of minutes talking about clinical placements, of which you will undertake here in the Bachelor of Nursing program. I'll just quickly jump to the next slide. And before we jump into understanding what professional placements are, do any of you understand or know how many hours worth of placements you'll undertake in your Bachelor of Nursing program over the 3 years, over 5 placement topics?
I think around 800.
800, okay. Anyone else? 900. Anyone else? Higher? Higher? I would say higher.
Why?
Only a little bit higher. 960, bingo, well done. So across the 3-year program, you'll undertake 960 hours of clinical placement. Now that seems like an awful lot, but that is broken across 5 different placement topics. So there are, and I'll take you through a bit of a breakdown of those individually in a moment. But what it talks to is the value of the learning of which you'll undertake, whereby you'll be able to apply all of that theory of which you undertake in the classroom, what you practice in the clinical labs, and apply it in the real world setting. So think of it as placement experience or work experience more so, perhaps what you might be more familiar with from school. So your professional placements will be an opportunity for you to go into a range of different healthcare settings under direct and indirect supervision and actually provide care to people across the lifespan. So it's a really fun and exciting way to learn. And by the time you finish the program, after those 960 hours, you'll be ready to enter a profession whereby you can work in any of the areas of which Bridget talked about at the very beginning. So a really unique opportunity to learn and apply those skills as you learn in that environment too. Oh, I seem to have missed a slide. Oh no. I did have a couple of slides which talked about the breakdown of those placement hours, but I can talk to that off the top of my head. So in first year, you undertake a topic which I'm sure you've looked at on your timetable called NURS 1027. That is your first placement topic in the Bachelor of Nursing program, and you'll undertake that in April 2027. So I'm sure you've received a couple of emails about compliance, so I'll talk about that shortly. But 1027 is a placement topic of which you have 2 weeks of placement or 80 hours. By the time you get to second year, you'll have 2 placement topics. So you have NURS 2022 and NURS 2026, and both of those placements are 160 hours, so 4 weeks. By the time you get to third year, that's when the placement blocks do get a little bit more bigger, I guess. You undertake 3011 and 3013, which both have 7-week placements. And all placements are delivered in blocks. So you'll do them all in one hit and they're full time. So you'll be doing 40-hour weeks across a 24/7 roster.
Do they cover our study courses as well, or do we show up and study the top courses as well? Or are they separate from our placements?
Yeah, so they'll be attached to a topic. So for example, NURS 1027 will have 4 weeks of theory, and then you'll have an intensive week. So you go into the clinical intensive labs and apply those skills in that simulated environment. And then you'll do the 2-week placement after that. So it's all, I don't have an example timetable for you, but what it will look like is the theory, there'll be an I for intensive and placement, which will be there in a different colour. So it'll be very clearly identified.
Do we organise our own placement?
No, you don't. We take care of that for you.
And the hours as well, do we get to pick how many hours we can add on and take off, or is it already set for us?
Yeah, so it's already set for you. So those, for example, in 1027, those 80 hours are prescribed to that particular placement block. And so accumulatively, you'll undertake the 960 hours in total. So they're designed in a way that scaffolds as your learning and your experience starts to build up through the program. So the first couple of weeks, or the first placement you undertake will be building on foundational skills. By second and third year, it's really enhancing that understanding, the assessments, the pathophysiology, that linkage of theory to clinical practice in a range of different care settings with quite complex patients too. So I guess sort of building on from that, I did have another slide as well which talked about the areas or the clinical settings of which you undertake placement in as well. So all of our placements are done here in South Australia. We do occasionally have opportunities in Mildura, which is across the border in Victoria, and also in Broken Hill, which is across the border in New South Wales. We also do have opportunities in the Northern Territory. So we have students that go to placement in Alice Springs, Tennant Creek, Katherine, Darwin, Nhulunbuy, and all around South Australia, both from a metropolitan and a rural and remote point of view as well. So we do like you to do at least one rural placement in your program, so you really get that diverse exposure of variety, and to really understand what it's like to provide care to people in different, in sort of some remote settings whereby resources might be a little bit more limited, perhaps compared to your metropolitan counterparts. So you'll undertake placements in aged care settings, in community settings, primary health care, in acute hospital settings as well, so medical, surgical wards, in perioperative settings, which includes before surgery, during surgery and after surgery. We also have paediatrics, specialty areas as well, such as emergency, which Bridget and I have talked to before, which we have come from in terms of our clinical backgrounds, intensive care settings, and the list goes on and on. There's quite a few different varieties, and we ensure that you have a variety of experiences throughout your program. So if you start in a particular area, you do one placement, let's say in a community setting, we will try and make sure that throughout those 5 different placement, experiences, that you have quite a variety. So you exit again with that generalist skill set. So I'm going to jump across to the next slide here, which is going to talk about placement eligibility. So this is talking about the compliance. So this will be, as a first year student, a really big focus of the next 6 or so months for you. So I don't have an exhaustive list for you today, but what I guess I really want to emphasise is the importance of getting on top of this really, really early. So we do have a compliance calendar, which is not quite ready just yet, but just so you're aware that for your 1027 placement in April 2027, there will be a compliance due date of February 2027. So that might seem like a really, really far, many, many months ahead and not necessarily something to focus on right now, but I really encourage you to start thinking about your compliance now. I don't have an exact checklist on the screen here, but I have printed out the checklist that you'll find online, which you can see it's a lovely colour-coded document. There's quite a few different things of which you'll need to tick off, but it talks to things that you'll need to undertake to evidence that you are ready to undertake placement, and that includes evidencing your immunisations, police checks, fitness for practices, and the list goes on. So just make sure you have a look at that early and start making a plan for when you get those items ticked off and completed. It will sort of take a bit of time and it will cost a little bit of money with some of the things that you might have to go and get done, for example, immunisations or police checks. So have a think about how you can scaffold those activities across the next 6 or so months so you're ready to go come February next year. I'll jump across to the next slide. So resources to help you meet compliance. Again, this checklist is a really perfect way to get started. Print it off nice and early. Have it in your study or somewhere close to you so you can start to make a plan, as I said, early on. But in place is the on your Okta dashboard, the location of which you'll enter to upload all your placement documents. So in place, if it's not quite on your Okta dashboard just yet, you can add it on there. And as I said, that's where you'll upload all documents as required. So there's a lot of information on our websites around placements as well. So have park some time aside after today to go through that now, just so you've got, you're over what is required. Your GP will be a really critical stakeholder in all of this too, so make sure you engage with the GP about providing a history of your vaccination records, or if you require any serology as well, so blood test to evidence your vaccination status as well. So our student health and counselling do offer vaccinations as well, but I suggest you give them a call beforehand. They do have a clinic up on the main campus. There is a small cost for the vaccinations, but I understand that the appointments are generally covered. So just give them a call first to understand what the out-of-pocket costs might be. It's actually the CHE placement team, but our placement team, so it's che.placements@flinders.edu.au. They're a really valuable resource if you have any compliance related questions. They don't necessarily come to Jodie and myself, but the team are really helpful to unpack what you might be needing to upload, or if you've uploaded a document that's perhaps not quite ready, they'll let you know and provide you some guidance on what to do to ensure you're compliant in time. So we also have a uniform provider, Valerie Travers, in which you can order your uniforms. Uniforms are required for placement, which won't be until next year. So they're not required at all for this semester for any of your topics that you undertake. So just keep that in mind. It's not a pressing right now consideration. So some keys to success. So as I said, start getting on top of your compliance early. That's really, really important. If you have any questions, do reach out early. We're here to help you where we can. And I guess I'll put it back to the room. Are there any questions from me about placements in the program?
What's the different types of vaccinations we need to get passed?
Yeah, it'll all be on here. Let me just have there's a whole document that has, it's a immunisation compliance document. It'll talk to measles, mumps, rubella, polio. Look, there's a whole list here. I won't go through all of them off the top of my head, but it'll talk you through what's required. Often what you've had throughout childhood will be required to be evidenced. And if you haven't had additional boosters, or if you haven't had certain doses, you'll be required to go and get those boosters done. So have a look at the vaccination document and it'll give you a bit of an oversight of those as well. Are there any other questions?
Can the student ask help as well, or do we have to come straight to you guys for it as well?
Yep, so from a vaccination point of view, or just with all the compliance for everything? Sure, so if you have any questions, certainly start with the website. There's a lot of information on there. If you can't find the answer on the website, it'll be this email address down here that you can contact. It is now CHE, but it will go to, even if you type that one in, it'll go to the new email address. If there's any questions that needs to come to us as placement education coordinators, they'll just CC us in or forward it to us and we can help as well. Okay, you'll never be by yourself. We'll make sure you get on top of this as soon as you can. And like I said, no such thing as a silly question. So we're happy to help where we can. Okay, all the best. No worries. Oh, good.
All right. So please keep a check on your emails, because you will get information from placements team about that compliance. And it's really important, like Beck says, to get on top of those vaccines, because if you haven't had it before, you might need a booster. And sometimes there's 3 months or so between. Some of the vaccines can be 3 months between one and then the booster one, and you need to be completed. So you want to start early, yeah?
Oh, I was going to say, can we start earlier, like maybe next week?
Yes, of course.
Yeah.
And that would make Rebecca very happy if you started early. And all of that website is the placements. I think, is it on Flow? Do they have that access on Flow?
If you just type in Google Flinders University Placement Nursing, it should funnel you into a couple of websites which will have a lot of different links off to this compliance document. So around the checklist, around compliance dates, everything should be in the one spot. If you do run into any challenges locating that information, just flick us an email and we can send you it.
I might just pop it up in a minute, just so I find it for you. So one thing to remember, this is the last slide I'm going to do. Well, no, actually there's another slide to win $250, so hold on. But after this slide is that one. So just remember, though, that you are a professional now. The minute you sign on the dotted line to join the nursing team, that's what you are. You've joined the nursing crew. You are a professional. And that has to be translated through everything you do. Think about a professional. If you saw an airline pilot stagger onto your aircraft drunk and head towards the controls at the front, what do you think? I'm going to die. I'm getting off that plane, right? So think about what the staff and the patients will think of you. They're looking at you to be a professional that they want to look after them. You've got to think about, all right, if my nan or my grandma or my child was in that bed, would I want me to be their nurse? Do I know enough? Do I look professional? Am I behaving professional? And that includes your digital self. So I think a lot of people forget that digital space actually does link to you. So don't do anything in that digital space that's going to bring you and the nursing profession into disrespect. You know, you want to be sure that you're behaving like a professional everywhere. Because if somebody spots you saying something really unpleasant on your social media account, or behaving like you're going to have a punch-up in a pub, and they know you're a nursing student, do you think we'll hear about it? Very possibly. And do you think that's going to look good as a nurse? Very much not. Now, I know every single person in this room is never going to do any of that. But just to remember, you are now professionals, and I welcome you to the profession. And as a professional, let's have a look at can we get any money? So, there you go. $250 to tell us what you think. So scan the QR code and enter. Why not? Hey, have a go. You are in the Bachelor of Nursing. There are different pathways, and that is your college. You can get ahead of it, because somebody might not watch this, and there's only a few of you in the room. Your odds are high. I will just pull up. Has everyone got that? I will just pull up our website, see if I can find. Oops. See what Google will find me. That one?
Can you give that one a go?
Give that one a shot. That looks right.
Yeah, and so what you've got to go up a little bit there. So on the right-hand column, you've got the placement calendar, and then underneath that, that's this checklist that I've got in my hand here. So if you click on that now, even you can see it's all there, colour-coded, and it's triaged based on what we would recommend you start really early. Because as Bridget mentioned, that the immunisations can take a little while if you are required to have boosters. But it's all listed here. Like I said, there's quite an exhaustive list. Some are quite easy to do, and they are highlighted in the sort of the green colour as quick wins, so you can get them done quite effectively, uploaded, no issues whatsoever. But others will take a bit longer. And for example, things like basic life support, manual handling, you'll have to book in to have those done too. So just make sure you're having a bit of a think about when will be a good time to do that. If you just go back to the website over there, Bridget, at the very top. So it'll just provide a bit more information broadly. You can have a bit of a click through the website. If you go to the nursing student pre-placement compliance process, it's a bit of a matrix as to what, I guess when to start, what would happen, where to upload documents to. If you run into any issues, follow the matrix and we'll hopefully get you to where you need to get to. And I guess just keeping in mind that compliance is not just for the first placement, it will be sort of an ongoing, evolving process throughout your program. So there'll be some things that you have to do annually, there'll be some things that you might get to do once, and that should be appropriate for the rest of the program for the 3 years. But just make sure that you're always keeping an eye out for any emails from the che.placement@flinders.edu.au email, because they will certainly provide any updates or any reminders about things that might be outstanding to you as well. So never ignore those emails, always make sure you follow the advice given by the team as well.
Just a question about that.
Yeah.
Will the doctors that you go to get the vaccination or checkups or the list that they have, will they send it to Flinders, or do we get them to print it out for us and we can hand it in ourselves?
Yeah, so what I encourage you to do, there'll be a form which you can print out and take to your GP. It's not this form, but I'm just holding an A4 form to I guess, describe to you. It's an A4 piece of paper that will have a series of different vaccinations that you were required to evidence. Now, most of these you will have had completed throughout childhood. Again, you may have not, so that's why it's important to go through that early. And I guess what I'd encourage you to also take to that appointment with your GP is any evidence of your childhood immunisation. So MyGov, if you're born in Australia, should in theory have a list of all your vaccinations to date, or if you've got a blue, is it My Health Record, little blue book from when you were a child as well. Take everything that you've got to the GP and they can go through. There will be some vaccinations that you either have to provide evidence of 2 doses of, or serological immunity, which is a blood test to say that you've actually got immunity to, for example, measles, mumps, rubella. So have a look at the form when you can find it, when you've located it online. But I would encourage you to go to that first appointment with your GP with all the information you need to complete that document. Because if you do need to go and have a couple of blood tests done, they'll have to await the outcome of those blood test results to be able to effectively sign that document. So, for example, Hep B is one that we certainly do identify as one that, students may have had the Hep B vaccinations throughout childhood, may have a booster if that's required, but they do still require serological evidence of immunity, and Hep B non-responders are actually not as uncommon as you think. So we have a process that we follow to
manage.
ensure that any student who's identified as a Hep B non-responder is appropriately supported throughout the program to mitigate any risk. So at the end of the day, this is about keeping you and the public safe when you are providing care, because when you are nursing, you are looking after people in all different care environments, and you can be exposed to all different sorts of infections that, diseases that are ordinarily prevented via vaccinations as well. And sometimes, and especially having come from that emergency background, You can have anyone walk into an ED and you won't know, they may have hopped off a flight whereby there might be a case of something really highly infectious and high risk, and potentially you might be exposed. So it's about protecting yourself in addition to all other personal protective.
So if you don't get that done, you don't get placement. at all.
Exactly. If you don't get your vaccinations done, if you don't get all that compliance done, you can't go on placement, because we need to keep the public safe and we need to keep you safe. So if you go out there and you haven't had any Hep B vaccines, for example, and you come across a Hep B positive patient and you go down with Hep B, that's really unpleasant. So we don't want you to get sick, but also we don't want you to give anything to any patients as well, because their immune system may be down, and it's not really fair, is it? If you've got looking after a little 5-year-old who's got poor immune system and you give them measles, that'd be a bit rough, wouldn't it? So that's why. And so the placement venues won't accept you unless you're completely. That's why it's there. And it's not because we're trying to be difficult. It's that the placements won't have you. The hospitals won't take you in. Okay. Beautiful. Any other questions? Yeah.
For the hospital things, do they have different lists of vaccination they will want you to have as well when you apply for like a full-time nurse job?
Oh, I see what you mean. They're pretty much standard.
Yeah.
These ones.
So we
Yeah.
base our immunisation, in fact, a lot of the compliance of SA Health's requirements as well. So long as you're able to evidence what you've completed here, generally that's transferable to SA Health. But no matter where you go for employment, they'll still ask the same documents to be provided. If you are going to the Northern Territory for placement, they do have some different requirements around immunisations and other compliance documents. So if you do, we have an expression of interest that goes out annually for Northern Territory placements. Not something that we tend to put out for first-year students anyway, because we tend to put that more second and third year. But those requirements are specific to the Northern Territory. So it's just, no matter where you go in Australia or more broadly, you'll have to adhere to whatever requirements are necessary to the state and or the particular venue. Because some venues, for example, if they're a private venue, might also have different requirements or different expectations about the information you provide. So it's just, again, it's about just staying on top of your emails and any communication that comes from the placement team, because it might be you've been allocated to a particular hospital that requires evidence of you to actually take your immunisation record with you on day one, so they can have a look at it too. It's just all those sorts of ins and outs that we want to make sure you're on top of. Thank you.
Okay. Any further questions before we send you? Have you all tried to get your $250? That's just, these things are important. All right. Do you know where you're going next? What's on the hit list? Is it a break now? And then.
So he said you were going to kind of show us where some of the classes would be.
Oh, I am I? Okay. That's news to me. We can do that. All right. We'll do a tour. Thank you very much.